why is your office calling the AGs pro-politically motivated when many of your allies have called for people to support integrity? And why are you telling the public every day that 43,000 New Yorkers have died of COVID when actually that number is 54,000 and much higher? Why aren't you sharing the most accurate rate?
There are two different death rates. One is reported by the state. One we report to the CDC, which counts the death toll differently. There are two different definitions. CDC, we provide the data. They report one. We report the numbers the way we've been counting them from day one. Is that accurate?
Yes.
You want to explain the difference in the two? Hold it. Get an answer. If you want an answer, get an answer.
So the difference in presumed deaths versus actual confirmed COVID deaths, we have been, since this time last year, doing confirmatory testing for COVID-19 on all decedents in the state. We believe our number is more accurate. The presumed data is requested and is reported, and the CDC chooses to report that larger number.
Yeah, so in other words, there are two definitions. One is people who you actually know died of COVID. That's the number that the state reports. Actual confirmed deaths by COVID. CDC asks for actual deaths and presumed deaths of COVID. What does that mean, presumed death? Well, that means the nursing home operator or the hospital operator wasn't really sure, but they said we presume they died from COVID. Depending on how much faith you put in presumptions, that's one number. The actual death and presumed dead, that's the CDC number. Our number is actual death. On the AG's report, I said I have concerns as to the independence of the reviewers. That's what I've said. And is politics, is this all happening in a political system? Yes, that is undeniable. Question?
On the AG report, is your message to voters then that they should not trust the outcome of the investigation?
No,
and
not at all.
Do you regret initially authorizing the investigation a few months back when
Luis,
calls for your resignation?
As I said here today, I believe in New Yorkers. I am a lifelong New Yorker. I know New Yorkers. They are not naive. They know what's going on. They know what these reviews entail and who's involved. And when they get the facts, I am very confident that they will be shocked at what they have heard about this versus what they know about it. And I'm confident that when they get the facts, they're going to understand exactly what happened.
Governor, why are you calling the independent investigators?
Excuse me, you asked enough questions.
I know, but why are you calling the independent investigators unreliable? What's the evidence?
Look at who the independent investigators are.
They've been widely supported by you and many of your supporters and experts in the state.
Do a little history. Go to Google. Google the independent reviewers and tell me what you see. Yes, ma'am.
Do you think that the Assembly should only consider articles of impeachment based solely on the AG report?
The Assembly will consider, the Assembly investigation is broader and has a broader mandate and is independent.
Take through all of this, you can keep leading the state. We haven't seen you in 10 days as Delta has spiked. How do you reassure New Yorkers you won't go dark every time there's a major development in the AG's investigation?
Because I never go dark. That was said just before we were about to do the state budget, right? You had some elected officials say, oh, he's not going to be able to get the budget done because he's going to be distracted. We got the budget done. We got the budget done on time. And we've done phenomenal work every day since. And COVID, we are 100% on top of COVID. Now, COVID has been in a different place, obviously, than it was. And as you also know, COVID now, the state role has changed on COVID, right? You're aware of that? You're aware of the new legislation? Yeah, I don't think you are. The state was in charge of all COVID decisions, and which meant we made decisions for every locality in the state. That has now changed because COVID came down, the emergency abated, and we said, give the authority back to the localities. So now you have localities making decisions on COVID. So New York City will decide, Nassau will decide, Suffolk will decide, Westchester decides. So they're making decisions on the day-to-day management of COVID. I will say this to the localities. I think they should be taking this very seriously. I think this spike in numbers is alarming. I think when you talk about employees who work for government, who are public-facing, that we should be taking precautions. You know you have government employees who interact with the public all the time. One person who is infected can see 50 people, 100 people a day. So I think the localities should take this very seriously, and I would urge them to take significant action now. Now, the way we beat COVID is we got ahead of it. You don't win if you're behind it. If you wait for the numbers to go up, it's too late. I would urge the localities to act now. But by law, it is a local decision, unless, God forbid, the numbers get so bad, there's another state emergency crisis, and the state has to take over, which I don't even want to think about. I don't want to go through that again. I don't want to go through that again.
Will you require state employees to get vaccinated? What about state employees? Will you require them to get vaccinated?
Do you mind if I let someone else ask a question?
You can answer that question.
Okay.
It's important.
Yeah, okay.
Given the Delta variant and also given the fact that these indicators are going up, you see what's going on in France where they're requiring a so-called test for it for anybody to be allowed in any sort of public venue. Is that something you would think about or consider something that New York City now is saying, mandating either a vaccine or a weekly test for all employees?
Juliet, right now these are decisions that are left to the localities. We have not declared a state takeover of local control, which I did early on in the pandemic, right? And we had that conversation. I said this is no longer a New York City problem or a Nassau problem or a Westchester problem. It's all of the above. And to deal with it intelligently, you need one statewide policy. You can't have a patchwork of policies. In Nassau, you wear a mask, but you take it off when you go to Suffolk, and then you put it back on when you go to Queens, but you take it off in Westchester. So confusing. They had all these different rules. We're not at the point where the legislature has passed legislation that would allow state action. It requires legislative action. So it's up to the localities right now. Oh, well, nervous. I don't like the word nervous, Juliet. I don't get nervous. I think if you look at these numbers, the direction they point is clear, and to avoid these numbers, you do it at your own peril. You do not slow this virus with baby steps and incremental actions. You don't slow the spread that way. We learned that lesson. Been there, done that. So I urge localities to take it seriously and act seriously, especially, Juliet, public-facing employees, right? Where you have an employee who's interacting with the public on a daily basis and is touching 100 people. I think they should take it very seriously. I think they should also be targeting these same communities in their area. And they should have an effort like what we're doing statewide. Get into those communities. You know the zip code. You know where they live. Go knock on every door with representatives of the community. Why don't you want to take a vaccine? What are you worried about? Speak their language and talk them through it and get them a vaccine. But the time to act is now. Otherwise, you're going to see those numbers keep going up. And people took false comfort in, well, we hit 75% vaccine rate. We're done. Hallelujah. Let's have a party, a bottle of champagne, it's done. No.
Whether state employees must be vaccinated?
The state would have to legislate to say New York City employees or Nassau employees or Buffalo employees would have to be vaccinated. Statewide, you know, we don't run many hospitals, we don't run schools, we don't run local police departments, we don't run local fire departments. Those are really the public-facing agencies, tend to be local agencies. All right, we're going to go to work. Thank you all very much. Thank you.